Hi, my name is Abby James, and in this video I'm going to be demonstrating how to operate and maintenance anesthetic devices. And I'm going to go over a few things, but firstly I'm going to start with our pathway of anesthesia through the machine. So firstly, it's going to start here with our oxygen tank. The oxygen is going to go through to the regulator here on the back. That regulator is going to go through a flow meter that kind of controls the pressure and or the pressure and the amount of the oxygen source. That flow meter is going to go through our vaporizer here. We strictly use isoflurane here at my clinic. So it'll go through that to the vaporizer. The vaporizer will then go to the circuit, which this is a this is a rebreathing system. So this flows out directly to the patient. And when the patient inhales, they're going to inhale the vaporized anesthetic and the oxygen. When they exhale, that is going to flow through here, all the way through the little exhalation tube here, and that's going to go through a scavenger system, which I don't know, yeah, you can see it a little, through a clean air filter, and this will eliminate excess anesthesia and all of the waste on that. So I'm going to go ahead and kind of disassemble some of these things. The vaporizer, that is not able to be disassembled, but we can remove our oxygen tank here, our clean air system, and our chalk, our CO2 absorbent and our chalk here, our anesthetic bag here. You set that back down, and these hoses are also removable, and you can take and replace depending on the size of the patient, or and replace if in the scenario that a rebreather would be needed, or non-rebreathing would be needed. Okay. And then now I'm going to go over a few devices that are used to induce anesthesia and that assist us with the anesthetic or surgery process. Okay, I've pulled the anesthetic machine over a little bit so we can kind of see the table where everything's laid out, as well as the blood pressure monitor. So what this does is this allows technicians and the doctors and veterinary professionals to kind of regulate blood pressure throughout a surgical procedure. Blood pressure monitors can look like that almost sometimes, and we also have one, and they can look flat like this also. Most of the time when these monitors are actually turned on, there's typically a red light on there. And there'll be a red light here too. So when we put that on the patient, this allows for like it to be clipped down, and this kind of monitor, it would be like vet wrapped down. And I will turn the machine on, of course not the anesthesia or the oxygen, and just kind of demonstrate how that works and what it looks like when it's working. Okay, so this system is booted up. I'm using the smaller handheld one, and I'm gonna put this on my hand as a kind of a demonstration, but I'm just gonna stick it there. And as you can see, the little red light is on, so I'll just stick that on my arm. Okay, and it's picking up. It may not have like an accurate read positional wise, but it's picking up there. It does give the respiration rate, blood pressure, heart rate, and all of those things. Okay, moving on. Now I'm going to talk about the electrocardiograph. All of this does is allows like veterinary professionals to see and monitor the activity of the heart during a surgical procedure. There we are. And again, I'm going to try to demonstrate this on my finger or my hand. We may or may not have any success with that, but that's mainly like when you see like the little squiggly lines, that is the heart activity. I know that doesn't look great. Okay, there we go. So there's a little bit of something. But as you can see, or I'll move it in just a tad bit closer, you can see those lines are monitoring my heart activity currently. So we're going to move on to the next thing. Okay, moving on, we're going to go over the endotracheal tube. What this tube does is delivers oxygen and anesthetic to the patient during a surgical procedure. Most of the time, these instruments, they are preferred like with bigger, larger animals sometimes, or even smaller, depending on your species as well, over a cone or a mask, simply because this the endotracheal tube will actually prevent the animal from aspirating any kind of slobber, or if they happen to spit up or in any scenario like that, it will prevent any kind of aspiration during a surgical procedure, and you have a bit more like security in that way. So these tubes have a cuff on the end. As you can see, it's kind of like semi-deflated right now. So I'm gonna go ahead and inflate that. Okay, so that's what it looks like inflated, and all that does is block off the trachea. So the only source of oxygen and anesthetic the patient is receiving is through this tube. So that's why it's so important to make sure you have the accurate size and according to the patient. Okay, moving on, we're going to talk about the esophageal stethoscope. My clinic currently does not have an esophageal stethoscope, but I'll kind of insert a picture somewhere in the video, and I'm gonna, like, as I'm talking, and that way you can kind of get an idea of what I'm talking about as I'm talking over it. So the esophageal stethoscope is a specific kind of stethoscope, and you'll see when the picture is up, that there is a long slender tube on this type of stethoscope, and it is actually inserted in the esophagus during like a surgical procedure. You probably wouldn't want to do that when the patient's awake, but that allows for you to hear like better lung sounds, better heart sounds when positioned correctly. And they're very useful, like if a monitor's not working, or like you just want to double check and make sure everything looks okay and sounds okay with your patient, that would be a good thing to have. Okay, moving on, we're going to talk about the induction mask. All of this does, it's very good when delivering like or vaporized anesthetic or gas anesthetic to a patient that's like very small patients, or ones that like you probably would not use a lot of Tilazol or propofol with. And these also can be used throughout surgical procedures, and these come in different sizes. So, and I know that some of them have like an actual muzzle attached to them, which is fantastic. Or else you can actually hold this over the patient's face, and as like you or another person are restraining the animal. Alrighty, moving on, we're going to discuss over another instrument called the laryngoscope. I believe I'm saying that correctly. This instrument is used primarily in intubating a patient, or else if you needed to see down, the esophagus or trachea, which it would give minimal visibility trying to see down the trachea, but specifically the esophagus. But it's primarily used for intubation, and all this will do is this will hold the patient's mouth open while you're actually intubating, and that prevents you from having to either put your hands in the patient's mouth or either have a staff member hold the mouth open. And again, I will insert a picture of it so you can kind of get an idea of what I'm talking about, or like an image of what I'm talking about there. Okay, so in this next portion, I'm going to go ahead and go over the non-rebreathing system. This system is preferred like with smaller animals under 7 pounds, or like with exotics such as like birds, reptiles, and just smaller animals that, you know, you would want less resistance from the scavenger system canisters, etc. So how this works is this prevents the patient from rebreathing any of the waste anesthetic and oxygen. So this part will be directly connected to like a cone or endotracheal tube on a patient. And when they breathe in, they are breathing in from this tube, and when they exhale, it is going to go through this long tube here. And this has its own bag with it. This is kind of a small bag, like I said, designed for smaller patients. And this is actually going to go all the way through here. And this is designed to kind of go around or avoid the scavenger system, because that puts more resistance on the patient's breathing. So this makes it a little bit easier for like the smaller guys during an anesthetic procedure or a surgery. Okay, in this next portion, I'm going to go ahead and cover our oxygen source. So this is our oxygen tank. It is filled and done by a professional company. And they make deliveries about once a week to deliver our oxygen bottles. The oxygen levels are actually red over here. Let me plug that back in. The oxygen levels are actually red over here on this little dial. So when we turn this on, it allows us to see how much oxygen is left in the tank and when it needs to be refilled. That is important to pay attention to and to ensure that that is full during every procedure, because you don't want to have an accident where the patients can't breathe or there's not enough oxygen for the patient to breathe. Okay, so this is our rebreathing system. This system allows for the rebreathing of anesthetic gas and the oxygen. So how this works is this is connected to the end of your endotracheal tube or induction mask, and that way when the patient breathes in, it'll be from the inhalation side here, and when they breathe out, it goes back through this tube, or for the most part. I know that it's a rebreathing system, but it'll go back through this tube, through here, and into our scavenger system over here. And that will, the scavenger system works to kind of get rid of any kind of gas waste or anesthetic waste, so we're not breathing it in, and the patient is not just constantly rebreathing that in. Okay, and now we are going to go over to our pulse oximeter. So this will allow us to see the patient's heart rate and oxygen saturation. All of these little boxes are heart rate. This is our lung saturation here. This one up top will be our heart rate, and that is our SpO2 in the middle. This is also our electrocardiograph machine. So all of that will be shown over to the left side here. And all of your oxygen saturation, heart rate, SpO2, all of that, and it does do temperature here, will be shown here. Okay, again, we're going to talk about the respiratory monitor. So this will be clipped onto the patient, and as that is clicked on, this machine here will tell us the respiration rate, and how well the patient is getting like oxygen and how well they're breathing throughout the procedure. So next we're going to go over the scavenger system. This is the scavenger system here. So as I'm going to turn that over or remove that so you can see it a little better. As the patient breathes out the waste gas and the waste oxygen, or all of those things, it's going to be delivered through this chalk here, and that is going to filter out some of that as well, and it also will go through our clean air filter down here. That just prevents the anesthetic from coming out here and for us to breathe, and as well as it provides fresh air and fresh anesthetic and oxygen for the patient throughout the procedure. Moving on, I'm going to discuss over another instrument that my clinic doesn't utilize or doesn't have, and that is the capnograph. Again, I'll insert a picture down at the bottom of what this looks like as I'm kind of going over what it is and what it does. So the capnograph is used to monitor CO2 levels or carbon dioxide levels during surgical procedures. This machine kind of allows us to see the carbon dioxide levels in the patient, and it also allows it also catches maybe like machine failures or machine, problems, and it will catch if some of the ventilation systems and things like that in the machine are not working correctly. It also allows for monitoring of the cardiovascular health and how much CO2 is regulating through the body and all of that. Lastly, I'm going to discuss over the amnu bag. This is another instrument that my clinic doesn't have, but again, I'm going to insert a picture down at the bottom. This bag is mainly used for CPR purposes. It is a manual breathing system. So what this does is you'll hold the instrument in your hand. It comes in a little mask on the end with a bag on the other end. So what you will do in an emergency situation, if a patient isn't breathing or you're trying to assist them breathing, you will actually pump with one hand here while the mask is over the face, and this will deliver oxygen to the patient. I know some of these masks or some of these instruments actually will come with a attachment that you can actually attach to an endotracheal tube and manually breathe for the patient during a surgical procedure.